Hello, it's Dr. Gary Huber. I hope you're having a good day. I want to share with you a very exciting case, and this is not uncommon in our practice, but prostate cancer. I know, not a fun topic. Let me give you some baseline on prostate cancer. I want to tell you about a guy and some things that we did that were absolutely amazing. So first of all men have prostate cancer. What? That sounds unbelievable, right? There was a study once where they looked at guys 95 years of age and beyond, right? Some of them were autopsies, some of them were live people. And guess what? 98% of them had prostate cancer. There were other studies where they found that if your PSA is 1 or less, 17% of those guys had prostate cancer. Said another way, prostate cancer is typically going to evolve in guys over time, and the longer you live, the greater the chance that it's there. Now, prostate cancer is a weird beast. It's very slow growing. A prostate cell lives about 500 days and then it dies and it gets replaced with a new prostate cell. If you have cancer, they may live a little longer or replicate a little faster. But here's the key. If we can do things that make these prostate cancer cells die sooner, right, instead of later, or activate your immune system to kill them off faster than they can multiply, which is not that difficult to do, we should theoretically be able to win that battle. So unlike lung cancer, which is very aggressive and it takes hold of you, prostate cancer is very slow. And like I said, if you have a PSA 1 or above, the odds of you actually having prostate cancer are above 17%, right? That's a lot of guys. Lastly, we want to create a paradigm where we die with our prostate cancer, not from our prostate cancer. This is an idea that's been around for a long time. But I think these elements here help to define what prostate cancer really is, which is it's very slow growing. Now, things you and I do every day affect whether we're growing it or killing it. If we eat sugar, we're growing it. If we drink too much alcohol, we're growing it. If we have too much estrogen because we have a big belly, we're growing it. There are things we can do to reduce it. So when somebody has an enlarged prostate, they go to the urologist and they get a biopsy. I'm going to briefly explain one concept called the Gleason Score. These are normal-looking cells, and as they become less organized and more problematic, they turn into cancer cells, okay? So if I do a biopsy on a prostate, and let's say I got 10 pieces of prostate tissue, and I look at it, some are going to be normal. Some are going to have some degree of abnormality potentially, but that's what's called the Gleason Score. It's going to become important to you in just a second. Because if I rate this Gleason Score as a 7 or above, that's a problem. But if it's 6 or below, it tends not to be much of a problem. In other words, you can live with that kind of prostate cancer. So the Gleason Score, based on what does the cell look like when I biopsy it, if it's less than 6, or if your PSA is less than 10, well, there was a great study done by Thompson some years ago, and they found out that if we did nothing with those guys, I biopsy you, you have a PSA of less than 10, and your Gleason Score is 6 or less, guys actually did better if we did nothing. Years ago, we would have rushed in and said, oh, we're going to take your prostate out, right? We're going to do a robotic arm prostatectomy. Those guys had more problems, more erectile dysfunction, more bladder dysfunction, and actually lived less long than guys where we did nothing. Now, that was the Thompson study. Let's take that a step further. So I want to talk about this idea of watchful waiting, which is talk to your local urologist. He'll say, guys with low-grade prostate cancer, rather than treat them aggressively, we just watch them. I want to talk to you about being more active. So instead of just being passive, what if we did something? So meet my friend Brad here, okay? Brad's a 63-year-old guy. He came in and he had his PSA rising over a couple of years, and it got to a 9. When it got to that level, his urologist said, we should get a biopsy. And I would agree. A PSA of 9 deserves a biopsy. And when they did, they found out that his Gleason Score was a 6. And I agree with the urologist. He said, let's do nothing. Let's just watch this. Because your PSA is less than 10, your Gleason Score is a 6. This is a great chance to do nothing and just watch it, right? Well, his PSA rose a little bit, got to 10.6. And I talked to Brad and I said, rather than do nothing, let's not do surgery, but let's begin to take a more active stance. Let's begin to do things that make that prostate cell less inflamed and make that cancer cell die sooner, okay? So we did a few things. On March 24th, whoops, it says 29. I don't know why that's it. That should be this year, right? This is this year. So March 24th, we started them on some treatment with vitamin E, a special kind of vitamin E called tocotrienols. We put them on high-dose vitamin D because it has an impact on the immune system. We used some green tea polyphenols. No, he wasn't sipping green tea at the local coffee shop. We're giving him a concentrated version of green tea, and we put him on a mushroom extract that stimulates his immune system, right? And guess what happened? 5 weeks later, by the 30th of April, his PSA was down from 10.6 to 5. That's big, right? That is a huge change in a very short period of time. So rather than being passive and just watching, we took action. And we reduced the things that caused inflammation. And one of the things that we did with Brad was we reduced the carbs and sugar in his diet. And that had a good impact. So vitamin E, not just any vitamin E, not the one you buy at your local grocery store. These are tocotrienols, and they have a very good ability to stimulate apoptosis. Fancy word that just means cell death, right? So they have a good impact there. Vitamin D in high dose is an immune modulator. It stimulates your immune system, which is what helps you fight prostate cancer to begin with. Very simple, very safe, good amount of that. Green tea polyphenols. Again, there are certain compounds in green tea that have been long since known to help decrease the risk of cancer and help fight cancer. They increase glutathione, they help with your detox process, which we know is also very helpful for people who are dealing with cancer. And then lastly, a very specific type of mushroom extract called Empower that's been shown to increase the activity of your killer cells. Yes, you have killer cells. These are cells your immune system makes. They literally go through your body looking for bacteria, looking for cancer cells, and they attack. And if we stimulate them, they're going to work in our best defense. And then lastly, we changed his diet. We got him off carbs, reduced glucose. Cancer loves sugar, loves it. So when you feed it bread and Coca-Cola and pasta, it has a big party. When we don't feed it those things, it gets weak, and we can kill it with these other elements, all right? When I saw him back and we had seen success, we added zinc. Why? Because the prostate is the highest concentration of zinc in your entire body. And when the prostate has plenty of zinc, it can defend itself against infection like prostatitis. It can also defend itself against cancer, all right? So that's where we are with Brad. We've added zinc to the diet, and we're doing active observation, not just watchful waiting, as they call it. We're taking action, right? And we're communicating with his urologist, and he's happy with our success. And there's a very good chance that Brad is going to die from something else many, many years from now, and that he'll never have to have a surgical intervention on his prostate. That's our goal. That's our hope, that he dies with prostate cancer, not from it. Okay? So why do I share this case with you? I want you to know there are options out there. The urologists in this town are awesome. They're great. They're smart. But there are options beyond what traditional medicine offers, and we have the ability to take better control of your prostate health at any age and get the prostate to reduce itself, right? To decrease urinary symptoms and even decrease your risk of prostate cancer. Hope you learned something new. Hope I didn't confuse you. And if you have any issues or concerns about your prostate or hormone therapies in general, please call us. We want to be of help. All right? Take care. Have a good day.